Howdy doody everybody, my name is KevGuuey and welcome back to Elden Ring. I know it may or may not actually, I don't know how to actually start this. I don't know where I left off, but then when I release the videos, it will be left off at the correct place. But at the moment of me streaming this, well, you know, it's confusing. But that's what it's also a reason why I haven't been releasing videos and stuff, as it's just let me explain. So recently well, actually, before I actually tell the story or explain my health condition at the moment, I want to thank my members who are Stoner Michael and also the Magikarp Karp. Thank you so much, you two, for being members and staying members to my channel, my YouTube channel, while even under these conditions where I haven't been able to content and stuff because of what's been going on with me. But thank you so much for supporting me by being members, you too. Stoner Michael and Magikarp Karp. Thank you so much. So recently I caught something. And from time to time, because of the whole pandemic happening and everything, right? You know, you're indoors a lot, you're always indoors for most of the time, kind of thing, and then, you know, a sedentary lifestyle happens, you know, at times, or it doesn't for you. You know, people are different. But you know, for people that started becoming into that sedentary lifestyle, you know, your body's immune system fluctuates. It fluctuates because you're not getting enough sunlight, vitamin D. You just need 30 minutes outside in the sunlight. I mean, I literally have my blinds open. Oh, where'd my camera go? Okay, yeah, you know, you have blinds open, you have or just go out and get some sun, whatever, you know, vitamin D. I take vitamin D supplements. I've been taking multivitamin supplements forever, just because just in case I'm missing vitamins from eating or from something. I don't know. It's usually just like a precaution kind of thing. But anyways, so that I don't know why I was putting this backstory, but anyway, so the thing is, so recently I started feeling sick. And oh no, wait, the backstory. Sorry. I got COVID brain right now. Well, I just pretty much explained it. My brain is very foggy at the moment, and it's not great. It doesn't feel great. Kind of foggy up, but okay. So, recently I've been feeling sick. And in the past, I felt sick. You know, I've been sick before, so I know what the symptoms are, having a cold versus having a flu kind of thing, right? And I've never had COVID, and I've been doing my best, like super precautionary best, with keeping clean. It's kind of also my OCD. If people didn't know, I've always had OCD for that. It's a long story. So yeah, so I would even now with restrictions going down, and mandates going down, you know, I still wear masks. All right, I still wear masks. I wear the N95s or the N95K or KN95. I forgot how it's named, but I still wear that. I wear gloves. I even wear gloves. Okay, that's how cautious I am, because I have grandparents. I don't want them to get sick. I don't want to get anyone else sick. All right, I don't want to get my family members sick, especially my mom. I love my mom, and so so you know, I've been sick before, and I get tested. Oh, and I'm also, backstory to this is, I'm you know, vaccinated. All right, I'm vaccinated. I'm boosted up the wazoo. So yeah. So you know, before, as I said, I've gotten sick before, cold, or the regular flu sometimes. The cold, I can tell. I get the chills, the muscle aches that are always there, chills, that kind of thing, that kind of stands out, right? You know, the exhaustion, the fatigue, that kind of thing. When I got the booster shots, the vaccines, I got the muscle aches, of course, a bit of the chills, no, nothing sore throat or anything of that sort. Muscle aches pretty much it, and let's see. Yeah, but like, not really runny nose, or maybe there was a bit of runny nose from the booster, the second booster, or the second shot. But yeah, but anyways, so recently when I got COVID, I still have COVID. Slowly, it's slowly going away. The symptoms are going away. Thank God for the vaccine and booster shots. Because I've talked about this a lot. And that you need to get vaccinated. You do. Please get vaccinated. Please get boosted. Because if I wasn't boosted or vaccinated, I have asthma, by the way, as well. So that's also a worry for me. But CDC doesn't, you know, count that as a you know, high priority kind of thing, because, well, even though it's a respiratory thing, but you know, whatever. So I've been so after oh yeah, so yeah, with the booster and everything, you know, and doing my best for precautions and doing all that. Again, wearing gloves outside, like surgical gloves, you know, like doctor gloves kind of thing. Not like, I don't know, hazmats. I don't know why. The first thing I thought of was like a hazmat suit, but no, I don't have it. I don't have a hazmat suit. Okay, I don't have that money to go buy a hazmat suit. All right, and I would have to spray that down every day, or every time I go out. Okay, whatever. I don't know why I went on a tangent. My ADHD. Anyways, so yeah, so recently I felt sick, but it wasn't the same feeling of this illness or the symptoms, right? It felt more so like, when I had the chills, right? I had the muscle aches, and I started and then at the same time I had throat, like sore throat, phlegm build up there, or it felt like strep throat. It literally felt like strep throat. Okay. Like eating anything, swallowing anything, drinking anything hurts a lot. Okay. My headache's exacerbated. All right. That means it got worse. It made it worse. So those are the symptoms that were different. Okay. And also the fogginess of the mind, the I call it COVID brain, because you sometimes you just kind of word retrieval sucks. You try to think of a word, it's on the tip of your tongue, you don't know what it is, it's right there, you can't get it. Yes, those kind of that instance. But yeah, so the first day I was like, oh, I don't feel well. This might just be a cold. I don't know. Maybe the actual flu, because I've been very cautious, right? But then I thought about it, because the 2 days beforehand, I went in a doctor's appointment, and well, Omicron takes 2 days to incubate, right? And well, 2 days is today that I'm feeling the effects, and like, oh no, this is not good. But I still didn't think it was COVID. But I took care of myself. I took the flu medication, the Dayquil, the NyQuil, all that. And warning, don't count how much acetaminophen you're taking from those Dayquil NyQuils, okay? The recommended dose is to be safe is at least 2,000, okay, 2,000 milligrams a day, okay, and that is following the instructions of taking the 2-pack, or the packs with the 2 pills in it, every 4 hours or whatever. But don't take over 3,000 milligrams, because each pill is 625 milligrams of acetaminophen, or aka Tylenol. Okay? But anyways, yes, because if you take over 3,000 each day, and it tells you not to, there's a big warning, okay? It will damage your liver. It will damage your liver. It will damage your kidney. You don't want that. You don't want to go into dialysis, okay? You do not want to go in dialysis. What is dialysis? You go to the hospital or an outpatient clinic, and they cycle your blood. They filter out your blood with a machine. You stay there, and you have to go there at least 4 to 5 days a week. Stay there for 8 hours, or 5 to 8 hours or something, okay? So and then they filter out the blood. It takes time, a lot of time, and you don't want to do that. I did a clinical there as a nursing student, and man, it's very sad, especially when there are kids that are there too. It's just they're always here because they have to get their blood filtered out and cleaned, and it made me sad. But okay, regardless, don't overdose on any medications, okay? Don't take too much, because taking too much of something will hurt you. Don't do it. All right, that's actually advice. Just don't overdo it. But yeah, so I've been taking, so I started taking that, and then the next day, again, I went on tangent, whatever. The next day, it's still here. Like, it got worse. I'm like, oh no, this is not good. This is not good. No one's home, and I'm like, okay, well, I need to go get a test. I need to actually go get a home test kind of thing, because trying to get a freaking like lab test, like at a pharmacy or a hospital or whatever. There's a freaking waiting list. It takes forever. Okay, last time I had to do it, it took like a month. I'm like, I need to get tested, but because I might have a month, sir. We got no room. A month. I'm like, oh, but that's it. That my COVID may or may not be. It might have been overnight, or I might just be hospitalized. But a month, sir. Okay. So I got my COVID test, my home test. Thank goodness the insurance paid for it, because they, and I did the test, and it said, wait 15 minutes after you do this, the brain tickling. You stick the big old Q-tip up thing, you tickle your brain a bit, you don't really tickle your brain, okay? I'm just saying, you don't tickle your brain. It's literally just on, like, at the bridge of your nose there, okay? You don't literally stick it up to your brain, okay? Don't do that. Okay, listen. I know it might be common sense, but some people take it literally for some reason, okay? So I gotta, save my booty and literally explain that no, you don't go and stick that up your nose to tickle your brain, okay? Like, I don't know, some people just don't understand jokes at times. But anyway, so you do that, you do it 5 times, you do another 5 times, and then you got like a little mixer thing, liquid mixer, and then you pour that in, and you it's like a little vial, and then you take the Q-tip with all your boogers and your all that nice stuff in your nose. No brain matter, by the way, okay? So letting you know that. I don't know why I have to explain that, there's no brain matter, because you don't tickle your brain. Anyways, so you stick the thing, you twirl it around, you swirl it, you twirl, you swirl, and you whirl, and all that good jazz, right? And then you take it up, take it out a bit, and then you squeeze the Q-tip so that all the fluids get in there, and then you pour on the paper or the little testing tray where there's the paper, and then it goes down. It literally just goes down, and then it will show a T or a C. It shows a T and a C. So now I forgot which one it was. I don't know if it matters which one, but it's pretty much, if there's only one line on the paper on another T or is a C or whatever, one line, and the other one has 0 lines, no lines, it's just blank, you're good, no COVID. All right. But if there are 2 lines, no matter how faint it is, even if it's like a very, very, very faint line in one of those, and then you have another line as well, that it is you have tested positive for COVID. Takes 15 minutes. Well, I mean, that's usually just waiting for the liquid to hit the papers, I think. But I mean, literally when you see it hit, when you see even a feint of the second line, well, you don't really need to wait full 15 minutes. But I mean, waiting the full 15 minutes, it literally showed a big, thick second line. So I mean, okay, thank you for clarifying. I have really deep, real COVID. Got the all in me. So that was great. I had to isolate myself away from my family. and it was, yeah, eating was terrible. I couldn't eat anything. I took the Dayquil, NyQuil. I took all of it because there's phlegm even now that builds up in my throat, and it sucks. Like I don't cough. I don't cough it up. I don't like, go, kind of thing to try and get it out, because it's it's in my windpipe, right? My larynx. So instead, this is what I like self-learned at home or when I was younger, of not destroying your throat. I don't even know if I want to talk about this or say it, because I don't want this to be interpreted in some weird way. But yeah, I found another way to get the mucus out. Not sticking anything inside my throat to get it out, by the way. No, none of that. But found a different way to easily get it out, or not easily, but like get it out without killing my throat by coughing a lot, because it is like sharp pain when I'm coughing. When you have like something like strep throat, it feels like strep throat. I don't know if it was strep throat, but it wasn't it, because the COVID test only tests for COVID. It doesn't test for strep throat. So if it tested positive for COVID, yeah, it's not going to test for strep throat. So it's not strep throat, but it felt like strep throat. But I didn't have a fever, so yeah, it wasn't really strep throat. But I'm just calling it strep throat because it hurts a lot. But when eating and drinking, okay, I'm just stating this, okay, for context purposes. Yeah, so pretty much I had strep throat. Just eating anything sucked. Drinking water sucked. It was bad. It was bad. I felt tired a lot. I felt lethargic, fatigued. Yeah, it was just I had COVID brain. Even now I have COVID brain. Like it just feels foggy. Just kind of like I can't think straight. Like a stuffiness in my brain, like a stuffiness in my head. That's what it feels like right now. So yeah, so most of the pretty bad symptoms have slowly gone away. It seems the chills, the muscle aches. I still have sometimes a runny nose, but then again, this could be it doesn't seem like it, because I've been taking the NyQuil and the Dayquil and all that stuff, so it's more or less not there. But yeah, I'm not taking that forever, because that would destroy your liver and your kidneys. So yeah, I'm not taking that anymore. But throat still hurts a lot. Actually, not a lot, actually, just at times. Is when the mucus builds up and I want to cough and try and get it out. It's hard, and then and then you don't want to cough because it hurts, that kind of issue. So yeah, and again, with the whole lethargy and the fatigue and then the COVID brain, and it's just like. And also the feeling of the need that I need to finish, actually finish this game. I was thinking about this, that I could try and finish the PC, right? Finish building the PC. But the other problem with that is I'm afraid, even though the new PC is better, and playing this game would be much better, I'm afraid, because I got lucky with this game running, even not as great as it is at performance wise. It's not preventing me from playing it at the white screen of death, or I'm calling it that. where the loading screen, the screen where Bandai Namco's logo comes up, kind of thing. A lot of people get that freezing or something, and then they can't play it. It locks them out. It closes the game, or you have invisible enemies, and that's a really bad thing too. So I can't really. I've been kind of stuck because I wanted to play this game. I can't play it because I'm sick, really sick with COVID. But I had no fever, thank God. No fever, no respiratory issues, as in like my breathing is okay, is fine. And I have asthma, and so taking the vaccine and then the boosters was so important, which is why I immediately went to get those. Because if I didn't have those shots already, I would be in the hospital. I wouldn't be here. Okay, I would be in the hospital. I don't even know if I would actually be here. Just because of my asthma and how stressful the symptoms of the respiratory problems it causes from a medical point, from researching and learning about it, and yeah, I don't know if I would even be here, to be honest. So thank God for the vaccine and the boosters. So I definitely recommend everyone to please take it, because I took the most precaution. I wore gloves. Okay, I wore gloves. I wore the KN95 or N95K. I don't know what it's actually called, but yeah, I took the most precautions. Like, I would have gloves up the wazoo, just out there, outside, if I ever have appointments and everything. Everyone, don't wear, like, no one wears gloves. Okay, no one wears gloves outside. Like, oh, it's so stupid. Why are you wearing gloves, sir? Kind of. Right. No one says that to me, because the, like, 6 feet, whatever. So stay away. But anyways, yeah, and it's also like a extra protection in that sense too, where when you put on hand sanitizer, okay, first of all, the hand sanitizer, okay, on your hands, when you put a lot of it, it gets caked up, okay, it gets layered. So when it's on when you have gloves on, right, and you get sanitizer, and you get all that, you just wash it anyways, because you're touching stuff and you're touching everything. You don't know if people coughed in their hands. A lot of people do too. People don't cough like this, or cough in their shoulders. They don't cough through their elbow. They don't do any of that. Not a lot of people do that. They cough in their hands. All right, they go "Achoo!" right in their hands. Okay, like, come on. But yeah, so like touching like doorknobs, touching anything, literally it's just like, okay, well, I got gloves on. I'll just sanitize my gloves. All right. And then if I gotta eat, I'll take off the gloves and then wear a new pair. Easy. And then it's fine, right? And then I got sick somehow, so I don't know. But then again, it could be because of the lax mandates and everything else, and mask and stuff. I guess that is the reason why there's a rise in COVID cases now again. But anyways, I'm still sick as of this recording or stream. If you're watching it in the future of the VOD, well, I'm better now. Thank you for your concern, though, for listening. From an old, yes, from the future. But yeah, so. But yeah. So, I guess my advice, if you don't have immediate emergency symptoms from COVID, like what I had, just chills and getting and just kind of throat hurting. Breathing's fine though, or no fever like that. Again, the only thing I could think of is like porridge, some sort of porridge, some soup, pretty much some soup, mashed up, stuff. Drink Pedialyte, because Gatorade has a lot of sugar. You don't want sugar. The Pedialyte pretty much takes care of the electrolytes, and it has less sugar. So I mean, so it helps. And yeah, take take the Dayquil, NyQuils and stuff like that if you want to or need to. And I mean, there's no medication for it. It's kind of like a flu, but worse, a lot worse. Just I mean, that's the only thing I can think of. Drink lots of water, by the way. Drink lots of water. And also, again, the Pedialyte, because it has electrolytes. Water has no electrolytes. So, yeah. So, but until your throat actually feels better to eat stuff, like me just recently, I started eating the solid foods and stuff like that. So, but yeah, it's bad. COVID is bad if you most likely have, if you didn't take the booster vaccine. Like I can't imagine how much more intense the symptoms would have been. And yeah, and my throat was dying too. It's just like my throat, the first few days literally like sounded like the Mongolian throat singing. That's how deep my voice started getting, and it's getting that like sounding voice. But it was a lot deeper. It was like, but more clear too. It was just like, wow, my throat is just dying. So yeah, it was just like drink lots of water. Just keep drinking water. Try and drink water, even though it hurts. And yeah, the first few days horrible, and then it started getting better. And well, now I'm back here, even though I still have symptoms and stuff like that. I still have COVID. I'm trying my best to continue streaming. So that is, well, I know that took a long time to explain and try to, yeah, but it's more so to just kind of explain to you that COVID is very serious. Just because the mandates and stuff like that are lowering and kind of stopping, doesn't mean that COVID is gone. It feels like people see that happening, the mandates and the mask mandates, the regulations surrounding the whole the pandemic, restrictions and stuff like that going away or still dissipating. It seems like people just kind of just be like, oh, COVID's gone, COVID's not here anymore, I don't need to be cautious anymore, I don't need to wear a mask anymore, even though COVID's still here. But I don't. They said I don't need to wear a mask. I won't need to wear a mask. It just seems COVID's gone. All right, that was sarcasm. I'm just saying YouTube. Okay, YouTube. That was sarcasm. I'm. Ugh. But yeah. So I think that's why I got sick too. It's just people aren't being cautious anymore. And I think recently, it like the U.S. literally broke 1 million people that you know, rest in peace in the U.S. That rest in peace. 1 million people, broke 1 million people. Horrifying, terrible. But yeah, so again, take your vaccines, please. If you haven't, please take it. Get your boosters. If you haven't, please take your boosters and just still wear masks, please. I know it's kind of uncomfortable at times, but please just wear like masks. You don't have to wear gloves and be a weirdo like me, okay? Who's very, very cautious about it, or even so. But just continue to wear a mask. Just stay safe, please. Stay safe for others as well. That's the whole reason you wear masks, to keep yourself safe and keep others from getting it. That's the thing I'm worried about too, is my family members, my mom, my grandparents, and stuff like that. It's like, I don't want to transfer it, all right? I don't want to transfer I don't want to transfer COVID to people, all right? That's the whole point of why I'm so cautious, and that's because of my OCD. But yeah, that it's like that's why I rarely see my grandma. Okay, my grandmama a lot. It's literally because I don't want her to catch COVID. I don't want to accidentally have COVID incubating, and then all of a sudden I go see her and then she gets infected. Okay, and then my grandpa gets infected, and it's just like that. No, not doing that. So this pandemic sucks. And like I really just, yeah. And I mean, after what, a week or so, right? It should eventually be okay. Where my like, from when I was talking to the pharmacist, they said that I could still test positive for COVID, which sucks if I do. I mean, they said I can still test positive for 3 more months, which again sucks. But by that time, within a week, after, I was like, oh no, stream went down. How long have I been talking? Did they hear everything? Did they hear nothing? Did they only hear I got COVID, and then just missed the whole explanation? And it's like, no, I talked for an hour. I just lost an hour again. Okay, but anyways, yeah. So just stay safe. Just get vaccinated. Yeah, and be isolated. Oh yeah, no. What I was talking about was like, in a week I should. Yeah. It won't be transferable after a week if I do another test, which I will by then. See if I'm positive or negative. But if I'm, but yeah, again, it's still my body for 3 months apparently. So, but the symptoms will be gone. So at the moment, it's still my throat hurts, my strep, again, strep throat. The mucus in my throat, sometimes a runny nose, not really. Fatigue, lethargy is still there. COVID brain is still there, as in fogginess in my mind thinking straight is just kind of thing. So yeah, that's what's been happening to me recently. Yeah, so yeah. For COVID. And I understand that I'm uploading this pretty far out. My Elden Ring playthrough, even though some of the other videos are unedited or not edited yet to be released, but I think this is a good health update of what I've been going through. So because yeah, even though it might be a bit spoilery, kind of, maybe. I'll find a way to not be the spoiler. But anyways, that is my health update for I know I was gonna say I was gonna play the game right now, but that actually became a pretty long health update that needed to be really explained as to why I haven't been uploading or been just dealing with COVID. Not good, pretty bad and very severe. So you have to take care of yourself. Please get your shots. Please get your shots. Please get your vaccines. Please get your boosters. Thank you. Please. I hope you enjoyed this episode of health update, which I haven't done in a while, but I hope you enjoyed it. If you did, then please smash that like button, subscribe down below for more awesome videos. Don't forget to ring that bell to get notifications of my uploads, and also please again look up around your area for vaccines, your vaccinations, the shots, the boosters, all of that. Please. And right now there's a second booster shot where at the moment it's only for immunocompromised and elderly people who are 50 years old and older can get it. So if you're in that age range or know people who are in that age range, please tell them about it to get the second booster, if it's within the time distance of the other booster. But anyways, again, thank you everyone for watching this video of my health update, and I should be getting better soon, and I will see you all in the next one. Goodbye. I said I was man, I got put like disclaimers and everything every time now, because it's like people can take it the wrong way.